Facial feminization surgery are a group of surgical procedures, either to the underlying craniofacial skeleton or the overlying soft tissues, that are used to soften and feminize the facial features. Now, classically or traditionally associated with patients who are from a transgender and gender diverse background, facial feminization surgery is also sought after by cisgender patients who want to achieve a more feminine appearance. So facial feminization surgery encompasses a host of surgical procedures, most commonly forehead brow bone contouring, hairline correction or hairline lowering, cheek or mid-facial augmentation, feminizing rhinoplasty, surgical upper lip lift, chin reduction contouring, and jawline contouring, and lastly, thyroid cartilage reduction. It's really important that patients understand, or those that seek facial feminization surgery, understand that there's no one size fits all. Facial feminization surgery is very much bespoke or individualized to that patient. All patients have their own unique anatomy, and as a consequence of that, their facial surgery plan will be unique, bespoke to them. Certainly from a surgeon's point of view, it's important to ensure that patients are realistic in their goals and their expectations of facial feminization surgery. A surgeon, particularly in my practice, it's important that I'm not over aggressive in my approach. My aim is to maintain those identifying facial features and not to change those to the point that a patient is not recognised by their loved ones or their friends. I avoid over-aggressive bone removal. Over-aggressive bone removal can lead to an increase in overlying soft tissue sag laxity. It's important that sharp contours or angles are softly contoured to feminize and not over-aggressively managed. The overlying skin is also addressed. Now, in mild to moderate cases, this can be in the form of skin tightening, but in moderate to severe cases, it may well involve addressing the issue with aesthetic rejuvenative surgery, such as a face or neck lift. Now, recovery from facial feminization surgery very much depends upon the patient, but it depends upon what the patient has gone through. Most facial feminization procedures are performed under a general anaesthetic. Now, a patient may choose to have one procedure, but more commonly they will have a combination of procedures in one visit. It may well be that they also stage their treatment over a period of time. Classically, and what I have seen in my practice is that patients that are undergoing upper facial feminization surgery recover quicker. So there is less associated overlying soft tissue swelling, for example, compared to facial feminization surgery for a nose or the lower part of the face, such as the chin and the jawline, where the associated post-operative swelling will persist for longer. And we're talking about weeks to months. It's really important that you choose a surgeon that you have a good relationship with, but also that you choose a surgeon that is going to be very honest and ethical with you. Facial feminization surgery is not a one size fits all. It's very much bespoke to the individual. So with this and bearing that in mind, it's important to choose a surgeon that has a lot of experience with facial feminization surgery, but also has a very good aesthetic eye.